You said there are three things that are very, very important. The first of them, the patient comes and they have yet to be intubated, and they can weigh the pros and the cons. Now, what do you advise as a Muslim physician that Muslims have in their wills, in their wasiyas? What do you advise Muslim patients of yours who are worried they might, may Allah protect all of us, but a percentage are going to get this COVID virus? What is the conversations that should be taking place, and what are the factors that they need to take into account?
Right. So we're going over all three scenarios one by one. The first of them, before they're intubated, they're all normal and healthy. They're putting these conversations now.
Yeah, so I think that families now have to have a conversation about what they desire to be their end goal, right? So I want to be able to interact with my family. That might be a quality of mine, right? Or I want to be able to do the salah, or to be conscious enough to do the dhikr. And if that's a goal, you can ask the physicians, if we intubate, how likely is it they will reach that goal, right? And when you have a family conversation, you've told people, that's the goal I want to move towards. And if there's not a dominant likelihood I'll get there, then I don't want that treatment, whether it's a ventilator, whether it's antibiotics, whether it is whatever, surgery. But I think families need to say, here's the state I'd like to live in. And for me, and I advise, it's taklif, right? That even one istighfar, right, might have the ability to move us from Jahannam to Jannah. So if I can have that one istighfar, I want to live life. But if I cannot, I have to be sedated, or I will be in a state where I will have no awareness. Now I can use the clinical term, persistent vegetative state. I would not consider that to be a life that I would like to be living of Islamic quality. Okay. If I had that before. Now, so that's the conversation about withholding.
Excellent. To be precise, though, that is your personal preference of what you would want a dignified life to be. And again, to be Islamic, others might have a different level of preference.
Right. Okay. That's what I was asking you, right?
Excellent. Yes. From an Islamic perspective, before the intubation is done, if there is no certainty that they will be saved, then it is not obligatory on them to undergo that procedure according to the vast majority of scholars. And should they opt out and they feel that it is undignified from their own perspective to be intubated for, typically, by the way, how long is the intubation for the COVID patients, just on average? Give me a rough average.
Well, we don't have we don't have good data. So right now they're talking about, in 72 hours or 96 hours we'll know if this person will get better. So that's initial trial period, right? And then sometimes people might be 2 weeks on it, but we try for 72 or 96 hours. And if they're not getting better, then the conversation becomes about withdrawing, which we'll talk about in a second. But that's how. So we don't have a good
3 to 4 days is the initial default. You're just going to get in 3 to 4 days, right?
Right.
Then after that, you'll get a preliminary assessment of how realistic it is going to be, whether they're actually going to come out or not. Now, suppose theoretically somebody is already elderly and they already have other complications, and they feel, I just don't want to go through that procedure. Islamically, my point now, the fiqh councils across the globe, and this is the standard position of all of the madhab. In fact, let me say, I don't know of any scholar that would disagree that given that type of scenario, it is not obligatory on this person to opt in to intubation. Hence, the conversation that this person might want to have, it's up to them, that they should tell their loved ones, their children, or their spouses, whatever, that if it gets to that level and they're gonna intubate me, then as long as they're uncertain about what the outcome is going to be, I don't want to opt into intubation.
So can I add just one nuance?
Of course, that's why we're having this conversation.
In the ER, right, I won't necessarily know you have COVID-19 or not, right? I might have to send the test. It might take a few hours to come back. So I don't want people to leave here thinking, okay, well, all intubations have this, high risk mortality, and that everybody should just say, I don't want intubation. You could have an asthma flare, and you could be a young person, and I can tell you with a surety that, or more than 50% will be fine after 1 day, 2 days, or 3 days. But if you have COVID-19 positive, then those statistics drop. So I think for families, we should have the general conversation of what my goal is. But if I get COVID, I need to know that the likelihood is that I might not get off. And I need to tell you that, and I need to think about that before I get intubated. And so that's the nuance here, right? It might be that they have asthma, but I don't want them to generalize from our conversation.
Perfect. So if the result is COVID-19 and then the intubation, then these statistics.
Correct.
Okay, so then this conversation needs to take place when everybody's healthy, everybody's fine, and everybody should have this conversation, because Allahu A'lam, you know what's going to happen. We were already seeing across the globe young men and women who didn't even know they had any symptoms, any underlying symptoms, are being put on intubators simply because, you know, you don't know what's going to happen at that stage. So these are conversations everybody should have. Jayyid. Now let's move to the second one, and that is the issue of withdrawing. And again, this goes back to the point of what is, in your opinion, your personal opinion, a dignified level of living. Now, the Sharia, by the way, doesn't have a very specific line here. And in fact, I don't want to go into too much, discussion here, but as you're aware as well, this is a gray area even within the fiqh councils about what is the fine line between life and death and between whatnot. However, generically speaking, most ulama would say a dignified living would be that in which you are aware of your surroundings and are able to therefore do some type of ibadah or dhikr, even if it is mental. That's the bare minimal level. Now, a lot of people would not want to just be aware mentally and not do anything physically, like basically their brains are functioning but not their bodies. To them, that would not be a dignified. A lot of other people would not even want to have anything lesser than this. And again, I gave this example a few months ago when I talked about the issue of not opting in for medical treatment. One of my teachers that impacted me the most on a personal level, a great alim, Sheikh Ibn Uthaymeen, Allah yarhamu, that he was diagnosed with stomach cancer, and in the year 2000 he came to America for treatment, and they told him that his prognosis was not that much, maybe a few extra months if he does radiation therapy, and if he were to do radiation therapy, they told him that you're going to lose all your hair, you're going to become sickly, you're going to become weak, you're going to be vomiting, this and that. And it might, if Allah wills, it might give you a few extra months or maybe even a year. And he was like, I don't want to. Jazakallah, thanks, but no thanks. And he went back and he did not undergo a single radiation therapy, not one, because he felt, and that's his decision. That's what I'm trying to impress upon the people, that really it is your haqq that you should be aware of, and you should have these conversations with your family before that time comes. That, alhamdulillah, in the case of Sheikh Uthaymeen, he was mentally fully alert and he could understand what's going on. But what would happen if you're not mentally alert? What would happen if your family, your children have to make this decision? And this is really one of the main reasons why I wanted to have this conversation with you, Dr. Aasim, because I've had this question posed to me in the last 2 weeks by 5 or 6 people in my own extended, direct circle, and 40, 50 people in direct circle. And you've had this question as well. And it is so difficult. Dear Muslims, you do not want your children or your parents or your spouse to make this decision, because it's already difficult enough to see you in that state. Give them some relief and mercy and make this decision for them before you get to that state, right? Do you agree with me, Dr. Aasim?
Yeah, so I'll actually give you medical data to back that up, right? And an Islamic point. So we know that families who have to make decisions to withdraw life support upon their families have symptoms of anxiety like PTSD.
Subhanallah.
Right? That you're actually causing them harm. We know physicians, right, who have to withdraw life support struggle emotionally with that. It's much easier to withhold at the beginning than now I see this body and 3 days, 4 days later I am the one. I am the proximate cause of withdrawing that tube, and they will die within minutes. So you're actually, by not making that decision, I would argue, you're causing harm to both your family and the physicians who have to do that. And we, la darar wa la dirar, as you know, so we should not leave this to them. I've had many families who struggle with this specific issue, and you know as well. So I urge people to have these conversations when they're full and capable, so inshallah we don't cause harm to others.
So this is such a difficult thing. PTSD, you all know what that means. You are causing emotional shock and trauma to your loved ones if you are not taking reasonable precautions by preempting what might be happening to you. And I'm sorry to guilt trip you, but Dr. Aasim and me, We are the ones that have to talk to the loved ones, because I've had to, even 3 days ago, I had to talk to somebody that broke my heart. Like he's literally, literally about to just break down emotionally. Why? Because he has to make the decision whether to pull the plug or not, of the medical support. And I'm telling him, look, the doctors have told you there's no hope, but he cannot help but feel guilty.
Right.
He cannot help but be traumatized that I caused my father's death. And I told him, no, you haven't. It's not your fault. You are not doing anything wrong. But these are words. It hurts him. It hurts me. It hurts Dr. Aasim to have to do it. All of us are suffering. And that's why I'm urging every one of you, especially those who are at high risk, and you know who you are, or speak to your doctors, to please have these conversations. And you know what? If you don't want to have conversations, at least put it in your will and let everybody know where your will is, right? Say, in case of emergency, open envelope, right? You don't have to talk to them if it's that awkward, but put it in writing. Have it notarized. Whatever is the legal mechanism, go to your lawyer and make sure people know that your will is over there. In case of emergency, open that envelope and document, so that it saves the family the trauma. And again, as the Sheikh, I've had to be dragged into this, and it's so emotional. The doctor has to be dragged into this. It's not my position to get in between fighting siblings, right? It's not my position to have to and it's so awkward, because they're already emotionally traumatized. They're already raw. They see their mother, their father on the ventilator, and then the Sheikh comes in and they're having a fight between the Sheikh and themselves. And then, Dr. Aasim comes in, and if he has to do it, one of them is going to be angry at him, the other one's grudgingly saying yes. Subhanallah, it's such a difficult scenario. And therefore, go ahead, yeah.
So let me tell you the other issue in COVID-19. So that's generally speaking, right? And my urging to our audience is that you actually not just want to put it somewhere, you want to have a conversation. I'll tell you why. Because right now, in the hospital, there's a no visitor policy.
Oh yeah, that's right.
Right? You're not going to have family around you to make that decision. There will be no one with you. You're lucky if you have someone to make dua or say shahada, right? And I've been called at a hospital. Can someone make dua for this person? We know he's Muslim, but there's no one around. And I'm telling you that this is not something you want your daughter, your son, your wife to, right? They can't even see you. And they don't know what to do. And at times, doctors will, if we get to this, may Allah protect us, this situation where we're rationing resources, the doctor will just do it and not tell you. Right? So I'm telling you, this is the time. We've always avoided death, right? But the hadith is, we have to think about this, not just stress, because these might be the moments you can repair your relationships with people. And you can say, no, we had a conversation, right? And my husband and my wife and my daughter are emotionally prepared for this trauma. That it might not even be in their hands.
Okay, in that case, scrap my previous advice of putting it in a will. You should do that in regular situations and scenarios. You're absolutely right, because subhanAllah, obviously in most states in America, no visitors are being allowed inside the hospital. And this is already the case in Europe and across so many countries in the world. No visitors. And what this means, as we're all aware, may Allah protect us, but they're passing away without a single loved one to hold their hands, without even at times the family being able to pray janazah at the gravesite in some places and lands. So the situation is indeed to that level of grimness that we have to preempt that difficult situation. And so do not just write it down, have those conversations with your family members and understand that they are aware of your feelings and desires, so that they don't, because again, I'm speaking to you as the Sheikh, and Dr. Aasim will speak to you as the doctor. I am telling you from more than 24 cases, not just over COVID, I mean overall, where the family members start bickering amongst themselves, and brothers and sisters are yelling and screaming that, and I literally had this case once, not over COVID-19, where one of the siblings was yelling at the others and at me, "You are murdering my father." That's literally what he's saying. How do you think they're going to feel and I'm going to feel? And it's not murder from an Islamic standpoint. It's not. All the majami' fiqhiyya across the globe have said that this is not a dignified state of living for him to just remain, in this, whatever you want to call it, comatose. I mean, he's not, there's no taklif, he's just lying there, and there's no hope of leaving that state. You're simply withdrawing medical support. This is not in the Islamic sense at all considered murder. It would be murder, a'udhu billah, if you inflicted a pain or a gunshot or something of this nature. But to withdraw life support in that situation and scenario, as I said, there is no scholarly body that I'm even aware of, no faqih that I'm even aware of that has said that there's any crime on you. Rather, I know of a number of scholars who have said it is mustahab to withdraw, because that person, you are prolonging the pain they are in. Many of my teachers, including Sheikh Yasir Qadhi, one of the greatest fuqaha alive, he said in this scenario, you are actually inflicting suffering and pain for no reason. And it is better and more dignified to simply let Allah's qadr take its course by withdrawing that support. So rather than having that difficult scenario down the line, we're asking you to preempt it and having this conversation. So to summarize this point before we move to our last one, the issue of the pros and cons, the issue of what is the minimal level of karama, there is no, karama means dignity. There is no hard and fast rule. And people might have different interpretations. Like I said, my Shaykh Ibn Uthaymeen, his level of karama was that I can walk on my own and pray on my own. I don't want to be on a bed and not be able to do sajda and lose my hair and be withered down. That was his notion of karama, very high level. And you know what? He has that right. Everybody has that right to have a higher level. And for some people, they'll be like, no, as long as I'm still mentally conscious, I'm happy with that. So, you have that option to decide what is that level. Think about it, ask your loved ones and whatnot. Once you've made up your mind, then have these awkward conversations about whether even intubation should be on the table, given the pros and cons of your particular situation. Only you know, with consultation with your doctor, the pros and cons. Have that conversation. Then have the other conversation that suppose the doctors say, there's a good chance you'll make it. Then after 2-3 days, they change their prognosis. And now you're intubated. And now they have to take it off. Rather than have your family worry about it, again, preempt it and save them that suffering and have that conversation, with them. So before we move on to our final point, which is the issue of the ethics of trying to use the same ventilator multiple times. Anything you want to add to these issues?
So, Sheikh, let me add, and you can correct me, but we oftentimes want to see that Rasulullah ﷺ did similar things. We want to act in the sunnah, right? And you and I both know in Bukhari and the other collections, Rasulullah ﷺ, near the end of his life, a family member tried to give him medication and he turned his mouth away.
On his deathbed, Sahih Bukhari.
On his deathbed, exactly. He turned away. And then he said to them, well, you taste it, right? And because he was, in my Aasim Padela interpretation, he was not wanting that, right? And people were trying to force that upon him. And Rasulullah knew his death. He had already said, Rafiqa A'la in Jannat al-Baqi. He knew where he wanted to go. And I think for families, we have to recognize this is not against the sunnah at all. This might be actually living the sunnah. Exactly. By saying, I actually decide that this is not beneficial, I do not want it. Exactly. I want to meet my Lord.
Exactly. Excellent point. So again, and like I said, I am not aware of any scholarly difference of opinion. There is pretty much unanimous consensus that the person has the right to make this decision, and he should make it, or she should make it in these circumstances so that the loved ones do not make it. So once again, one of the main takeaways before we move on to the final issue very briefly is that we are encouraging every single adult, male or female, and frankly, not just those that are in the high risk, obviously especially those in the high risk, but not just those that are in the high risk. We are encouraging every single person to think about these issues of whether they want to be intubated or not, if it is COVID-19. And if they are intubated, then what is the next procedure of withdrawing or not? What are the pros and cons? Think about these issues, speak with your doctor, and then speak with your family before they have to make that decision for you.